Limb length discrepancy in children can be caused by many different reasons. I mean, some of them are born with it, some of them are what we call acquired. Either they have infections during their childhood causing destruction of the growth plates, or sometimes it can cause by unfortunate things like cancer and stuff like that. However, there are various ways to actually sort out any limb length discrepancy. It all depends on the amount of discrepancy ones have to correct. For example, if the discrepancy is a small one, let's say a centimeter or so, then normally I will advise the parents or the patient that normally nothing needs to be done, because there's no proof to say that it caused any long-term problems, and it's easily sorted out by just adding a little insole into your shoes, and then you will equalize the limb length. However, if the limb length discrepancy is a lot bigger, let's say 3 centimeters or 4 centimeters, if you know that this discrepancy is going to be a problem, we can predict from a younger age, after seeing the patients a few times, we can predict once the patient reaches maturity, what the discrepancy is going to be. Sometimes we can correct the discrepancy by stopping the long leg from growing at the correct time. So you can remove the growth plates, hence the shorter legs will have time to catch up. However, if the patient said, no, I do not really want to be shorter than what I am now, this means I want to grow towards my potential. Yeah, so if I'm born to be 5'6", I want to be 5'6". If that's the case, then the other option is to lengthen the shorter legs. So there are various ways. If there is no deformity associated with it, means your bones are not bent, then by that 3 or 4 centimeters, it is easily achievable by putting a little rods or nail into your thigh bone or your tibia bone, and where these days we have what we call growing rods, where you can computer programs the rod to lengthen by 1 millimeter a day. It's all done internally, and that is one way of lengthening. However, if the discrepancy of the are quite big, on top of that it comes together with a deformity, means like a bent leg, then one of the methods we can use are things like an external fixators like this, which we call a circular frame. So this will be attached to the bone using wires that goes across it, and then all these little struts over here, by feeding the data into a computer program, one can tell the computer to say how much length you want and what are the deformities you want to correct, and you can adjust it on a daily basis to slowly correct this deformity. So there are many ways these days we can use to correct limb length discrepancy and deformity.